In this chapter, we are going to focus on joints, which are called articulations, as they are where two or more bones meet. So our first slide is going to go over the classifications of joints. So as I just mentioned, joints are also called articulations. Two or more bones are going to meet at that location. Joints are very, very important part of the skeletal system, and they give the skeleton mobility and hold the skeleton together. So when we classify joints, we do that based on two different criteria that you've already learned so far this semester. We do that based on the anatomy, which is the structure, and we do it on the physiology, which is the function. So we're going to make a little chart here first. So I'm going to zoom in a little better so it's a little more clear. So we're going to make a column, which is for structure, and then we're going to make a column, which is for function. So the large majority of the time, the structure is going to correspond with the function. So every word that I'm writing in the structural column refers to the substance, essentially, that is holding or tying the bones together. And we'll go over each of these more in depth throughout this chapter. So, fibrous joints are almost always referred to as synarthrotic for the function. Cartilaginous joints are almost always referred to as amphiarthrotic for the function. And synovial joints are almost always referred to as diarthrotic for the function. So you should be able to differentiate the structural terms from the functional terms. So when we look at the functional terms, I'd like you to note the root of the word looks like arthro. Kind of think arthritis. So if you see that root of the word, you need to think function or physiology. When you see the other structural words, remember they are referring to the substances like connective tissue that is holding those bones together. So as I zoom back out on this slide, we can see the structural terms like fibrous, cartilaginous, and synovial. Also, for the functional classifications, these functional classifications are going to also refer to the types of movements that are allowed at that joint. So there would be Synesthroses, which are immovable joints, amphiarthrosis, which are slightly movable, and diarthroses, which are freely movable joints. So we're going to first go into the fibrous joints, and then we'll work our way up to the synovial joints. So there are three groups of fibrous joints. They are all joined by dense fibrous connective tissue. There's no joint cavity, and they are immovable. So it depends on the length of the connective tissue fiber. So there's sutures, Syndesmoses, and Gomphoses. So our first one is a suture. A suture is a rigid interlocking joint of the skull. So you learned some sutures in a previous chapter. It allows growth during youth, and it has short connective tissue fibers that allow for expansion. But by the time we reach middle age, these sutures ossify and fuse into one complete bone. So it's an immovable joint that is one unit that protects the brain. And when it's immovable at middle age, it's referred to as a synestosis. So when you look at the word synestosis here, when you see the root of the word osto, that should make you think of an osteon. And in this case, it's referred to ossified bone. The next group of fibrous joints is a syndesmoses, and it's a bone connected by ligaments and bands of fibrous tissue. The fiber length is going to vary, so the movement varies. Short fibers offer little movement. That would be at the inferior tibial joint, which is what we see right here on this image. That ligament's fairly short. However, there is a longer ligament which offers larger amount of movement. That's going to be at your wrist joint, and it's the interosseous membrane connecting the radius and the ulna. So while it may allow a teeny bit of movement, it's still classified as a fibrous joint. The third example of a fibrous joint is the Gomphoses. And the Gomphoses, imagine the first part of that word sounds like gums. So it's a peg in socket joint. And the only example is where the teeth are in a depression called the alveolar socket. So there's a ligament here called the periodontal ligament, which is going to hold the tooth in a socket. Our next group of joints are cartilaginous joints. Remember, this is still a structural word. And there are two categories of this. They're united by cartilage, but they have no joint cavity like a fibrous joint, and they're not highly movable. They have slight movement. And the two types are called a Synchondroses and a Symphyses. When you see the root of this word, it looks like chondrocyte. So hopefully that will help you remember that it's cartilaginous. So when we look at the Synchondroses joint, we can see a bar or a plate of hyaline cartilage that unites the bone. And it's almost synarthrotic because it's going to be cartilage, and it's temporary cartilage. This is what you learned in Chapter 6 with the temporary epiphyseal plate joint. Remember that cartilage, as we get to adulthood, is going to ossify. When it ossifies, it becomes a syndesmoses after plate closure. And this is where it goes from the epiphyseal plate to the epiphyseal line, which is the remnant of the epiphyseal plate. More commonly, it's also called the growth plate, and that growth plate is going to become the growth line. The other place we find a Synchondroses is between the first rib and the manubrium of the sternum in this region right here, and that's also a Synchondroses. The second example of a cartilaginous joint is the symphysis, and the symphysis, it actually has a fibrocartilage pad, and it's a symphysis between two bones. So they're strong amphiarthrotic or slightly movable joints. So the examples would be the intervertebral disc, which is that fibrocartilage pad that you've learned about that acts as a shock absorber. The next example is the pubic symphysis, another fibrocartilage pad that's between the two pelvic bones, specifically between the two pubic bones.